Thank you. Hi, everyone. I'm Kirsty Wiseman, Partnership Manager for Reed Wellbeing. Here in Norfolk, we're commissioned to provide Norfolk NHS Health Checks and Smoke-Free Norfolk. I'm joined today by Spencer McCormack, who I'm moving on next month from my role. So Spencer McCormack will be your main point of contact here at Reed. So he's here as well. Next slide, please. So the NHS Health Check, it's provided by Reed Wellbeing on behalf of Norfolk County Council. It's a free checkup of overall health every 5 years for those who are aged between 40 and 74, and it identifies a higher risk of getting certain health problems. Sorry, next slide. It takes 20 to 30 minutes and it's conducted by one of our fabulous health check practitioners. An NHS health check, it's that overall check. So it's not a pass or fail topic. There's no right or wrong, but I consider it as a health MOT, a check-in. So height, weight, blood pressure, cholesterol, they're the physical measurements that it entails. It's combined with some lifestyle questions to establish risk. So it is assessing risk and helping people to understand where they are now. So it identifies the risk for kidney disease, diabetes, the risk for having a heart attack or stroke within a 10-year period. Through the physical measurements and the lifestyle questions, we're able to calculate and give a percentage risk of what that risk of heart attack or stroke within the next 10 years is at the end of the health check. And we're also able to calculate heart age. So we can calculate date of birth age. We've got the numbers to do that, but heart age is something that many factors contribute to. So it enables participants to go away with knowledge and understand where they are. The results are communicated to the GP, so everything is reported through to the GP, and everybody who has a health check takes away a card, like the lovely young lady in the photo there, with a traffic light sort of system. Green, great, you're doing well. Amber is, okay, we might need to be careful here. Red, we need to act in this area a little bit quicker. We don't at any point during an NHS health check tell anyone, you know, you're carrying extra weight. They tend to tell us that. We don't tend to be telling people if they're a smoker. They tell us that. But what we can do is prioritise, help people to prioritise what's important and where they can get some signposting from. Next slide, please. We've noticed a huge piece where people are unable to potentially access these appointments in the normal way. So NHS health checks, they're available in GP practices. In fact, we deliver for a lot of GP practices. They're available in community settings such as libraries, leisure centres. You might have seen us out and about on the WOW bus. So we often rock up in maybe a Tesco car park and we're doing some outreach work. But a big piece that we want to bring to more care providers is our workplace offer. So we've been recently to Corton House, Clare House, Centre 81 here in Great Yarmouth, About with Friends in Cromer. And what we've noticed is those who are caring day in, day out for others and making a big difference are putting themselves on the back burner and they're not doing the basic check-ins for themselves. So we have flexible options to support your teams. We'll come to you. If you've got a good amount of staff who are eligible, you may find you haven't quite got enough staff, but you've got service users, you know, friends and family, and you might want to do a bit of an event of it. Let us come to you. Or we have our community venue options. And if there's none near to you, please tell us so that we can make some more near to you. So ultimately, we want to make these as accessible for everybody. If somebody's on a tight work schedule, we're a time poor population. So if we're on a tight work schedule and then we're trying to fit in an appointment where we've got to travel an hour to get to it, it's less likely to happen. So we can arrange that to support. Next slide, please. There is an eligibility criteria for the NHS Health Check, and to be eligible, we need to be between 40 and 74. It's a Norfolk Commission service, so Norfolk County Council pay for this. So we need to either live in Norfolk or have a GP in Norfolk. We need not to have had a health check in the last 5 years, because it is a 5-year screening tool. And if we've already been diagnosed with high blood pressure, high cholesterol, already had a heart attack or stroke, and we're being monitored frequently, then we're not in that eligible category. If you're on a border with Suffolk or a border with Cambridgeshire, it's not that your teams can't have the service, it's just not provided by ourselves. But we can certainly signpost you to the teams who support with that, or help teams understand where to find that. Next slide, please. And I also mentioned here in Norfolk, we're commissioned to provide Smoke-Free Norfolk, smoking cessation, and help people to quit smoking. Again, in the care industry, we know that that can be a huge barrier, and in certain settings, it's the only time that people get a bit of a break. I get it. I've worked in care homes. I've worked in the out in the field doing care in the community, and we're here to help people quit smoking. We're a specialist level 3 service, so we're here for those who need us the most. Our teams are delivering smoking cessation. They're helping people quit smoking day in, day out. So it's not feet in the morning and we might have a stop smoking appointment, just the one dotted in once a week. This is specialist stop smoking support. There's no one size fits all. For some, they may need more regular appointments. Others might need a digital approach. Others might need just connecting with their pharmacy. We offer one-to-one appointments, groups, telephone, and we look at what is needed for each individual. So Smoke-Free Norfolk is where we want people signposted, but either by having us in for the health checks, we can do the smooth handover to the Smoke-Free team, or if you've got a high prevalence of smokers, we can do an outreach session to talk to your smokers and see if we can help them to start their quit journey. The previous slide where we had the photo of the team over at Corton House, they had their health checks, and we actually managed to get lots of health checks done, but actually 3 people on their journey to quitting smoking. So I think it's really nice when you see that to come through, and especially if you've got quite a few in one setting, they can encourage each other. So as a wrap, wrapping everything up, ultimately anybody who wants to talk about how we can bring this to your organisation, sorry, I think that's on the next slide actually, isn't it? I will encourage you to please contact Spencer, have a chat with him and see what we can do to come in to support you. Or if you need further resources, I know Alfina, I think it's just popping into the chat, how to book a NHS Health Check and how to access Smoke-Free. But if you think actually there is something we can do here, please do get in touch, and we'd love to support your workforce or your organisation, your community. So please do let us know. And I'll open up for any questions.